So our next speaker is Janice Callahan from the Metro South Mental Health Services. So Janice is the Primary Care Liaison Officer working for Metro South Addictions and Mental Health Service, and Janice has a background of being a mental health nurse for 30 years. And Janice is going to talk us through tonight and help us understand the changes to the Mental Health Act. So thank you, Janice.
Thank you. I'll try and make this a little bit brief because it's a huge subject. It's not actually my presentation, it's a colleague of mine, Dr. Tarun Sigal. He's a consultant psychiatrist. He's actually based at PA ED department now, no longer at Bayside. So I've just used some of his slides and a couple of my own. So you may know, many of you may know, many of you may not know that the Mental Health Act changed this year. It was from March of this year. So just some significant changes that might be useful for your practice. There's quite a lot of slides, I'll cut them down a little bit. So the Act came into being in March of this year. It was, oh sorry, can you not hear me? Thank you. So the Act came into being in March of this year. It differs significantly from the 2000 Mental Health Act. The Act clearly distinguishes between improving and maintaining the health and well-being of persons who do not have the capacity to consent to treatment, and those with forensic purposes of the Act where the persons are charged with committing an unlawful act. The significant changes is the way that the Act, people apply for an assessment under the Act, and where they do that, which is something that would possibly impact on some of your practices. Persons subject to an examination authority. I'll just talk a little bit about that briefly in a few minutes. This replaces the old JEO, which is the Justice Examination Order. This now falls under the Public Act. A person subjected to a recommendation for assessment or being detained while recommended for assessment is being prepared. Persons subject to the treatment authority, that replaces an ITO, an involuntary treatment order, and forensic patients on TSOs or judicial orders replaces various court orders. There's quite a lot of words on here, so I won't necessarily go through all of this, but the main things that would probably fall into some of your practices are the JEO, the Justice Examination Order. That is now the examination authority, and decisions on this are made by a mental health review tribunal. I'll talk to you a little bit more about that. EEAs is an emergency examination order. That replaces the EEO. So for people who are in a situation where they have a client who needs an emergency admission, it's still the same process, it's just that the terminology and the paperwork has changed. It would still be 000, and you would call for an ambulance who would get police assistance if necessary and take that person to the ED, to a place of safety where they would be assessed. The meaning of treatment criteria has been updated so that better supports the individual's rights for the person who does not have capacity to consent to treatment. It's the requirement of the Act that a person is treated in the least restrictive way, so lots of other options must be looked at first. And this also takes into account people who have an advanced health directive with the consent of a personal guardian or attorney, if the person's treatment can be met in that way. So people may say in advance, if I become unwell, this is the treatment I would prefer, and if that's going to still apply, then that would be taken forward. A comprehensive definition of capacity to consent to be treated is included in the Act as well. There's no longer separate assessment criteria and treatment criteria. The Act instead now says that it's a case for treatment. So a person can be detained by an authorised mental health service or a public sector health facility. So whilst a recommendation for assessment, think that should say treatment actually, is being prepared. You can now use visual audio technology to apply for assessments. The Act enables an authorised doctor as a designated in designated rural and remote areas to do both a recommendation for assessment and the assessment itself if another authorised doctor is not available. The Act enables a review of making a treatment authority to be authorised by a psychiatrist in a rural or remote area. That can be extended from 3 to 7 days just because of the geography. The requirements are included in the Act to discuss an assessment with the person and the support persons. Treatment authority may be an inpatient category or a community category, which is comparable with the Mental Health Act, but the default category in the community is to be the community. So just a little bit more, which probably applies to maybe more GPs here, I would say, is an examination authority. So an examination authority authorises a doctor or a mental health practitioner to enter the premises, detain and involuntarily examine a person to decide if a recommendation for assessment should be made for that person. An examination authority is a last resort where there are serious concerns about the person's mental health, well-being and voluntary approaches are not achievable. An EA would be for the types of patients who you may have who are not an emergency, where there's not an immediate danger or risk to themselves or others. They're not somebody who needs to be taken straight to hospital. They would be for those types of patients who are deteriorating, where there's evidence that there possibly is a mental illness, but they seem to lack capacity and they need to be assessed. To make the application for an examination authority, these need to be made at community mental health facilities. So there's a list of them where they are here. These are just in Metro South. I know some of you are from Metro North. So there would be similar community facilities, mental health facilities in Metro North. Before you actually make an application though, in that instance, what I would suggest is rather than it would be the person maybe who concerned relative who comes to you, or if the person has no relative that as a GP you might make that application, that you would ring MH Call. There is an MH Call in Metro North. MH Call is the single point of access for all mental health referrals for Metro South, Metro North, and also for Westmorton. They're all 24-hour triage services manned by clinicians, and they would give you an advice about how to proceed with that. Once an application is made for assessment, then that goes to the Mental Health Review Tribunal. This process in total takes about 2 weeks, so it's not something that will be a quick response. So the tribunal then review the application. They have a meeting or either phone or by person with the person who made the application to determine the grounds for that. And they make on the basis of 4 criteria: that the person has or may have a mental illness, the person does not have or may not have capacity to consent to be treated for the mental illness, that there has been reasonable attempts to encourage the person to be examined voluntarily, or it's not practical to attempt this, or there is or may be imminent risk because of the person's mental illness or serious harm to the person or someone else, or the person is suffering from serious physical or mental deterioration. And they make the basis of the granting of of the examination authority on those 4 criteria, and they have to fill all 4 criteria. If that's upheld, then the examination authority is enforced for 7 days, and what that means is that goes to the acute care team in the local community mental health team, and they will go out and assess that person at home. They may take the police with them as well. Transport to emergency. So for the EEA, so the Emergency Examination Authority, this is where you would contact the ambulance, and they may our police may come together. And those types of situations are where a person's behaviour indicates that the person's at immediate risk of serious harm. The risk appears to be a result of a major disturbance in the person's mental capacity caused by illness, disability, injury, intoxication or other reason, the person appears to require an urgent examination or treatment. The police officer doesn't decide, they're not required to decide what the reason for the person's presentation is. It's just that they are the people who would transport the person to the ED. In March of this year, the emergency examination order under the mental health legislation were replaced by EEA, which I mentioned. This change recognises that the person brought to the emergency department under these provisions may be suffering from conditions of an illness or other that are mental illness. Making of an EEA, so that's where you just basically, you would just ring 000. When the person is brought to the emergency department, they can be detained in the emergency department whilst the emergency examination authority is being made, so paperwork does have to be filled in. The officer then gives the emergency examination authority to a health service employee in the department, and the fact that a person is being received in the emergency department under an EEA needs to be recorded in the emergency department's information system, and that has to be kept in a safe place for future reference. People can be detained in ED for up to 6 hours or another place of safety in the hospital without the person's consent. A doctor or health practitioner may extend the period up to 12 hours to carry out the examination. A doctor or health practitioner must explain the effect of the EA to the authority to the person. A doctor or health practitioner must examine the person to decide the person's treatment and care needs. It could be done by a visual link. Another authorised practitioner or doctor may also be called to help examine. As a result, the outcome of making a recommendation for assessment could be, so the person may be admitted to hospital. The person may also be discharged once the examination authority has been completed, as they may not be felt need to be detained in hospital. In terms of the Act, these are the definitions. Mental illness is a condition characterised by significant disturbance thought, mood, perception or memory. The meaning of an involuntary patient is a patient subject to any of an examination authority, a recommendation for assessment, treatment authority, forensic order, treatment support order or judicial order. So these are people who are detained against their will. Capacity, a person has capacity to consent to being treated if the a person has capacity to consent to be treated if the person is capable of understanding in general terms that the person has an illness, symptoms of an illness that affects their mental health or well-being, the nature of the purpose of the treatment of the illness, the benefits, risks and treatments and alternatives to treatment, the consequences of not receiving treatment, and capable of making decision about the treatment and communicating the decisions in some way. So those are things to bear in mind when people talk about whether a person has got capacity or not. This section does not affect the common law in relation to the capacity of a minor to consent to treatment or a parent of a minor consenting to treatment of a minor. Treatment criteria for a person has a mental illness. The person does not have capacity to consent to be treated for the mental illness. And as I said before, the person's absence of an involuntary treatment or absence of continued involuntary treatment is likely to result in imminent serious harm to the person or others' physical deterioration, if the person suffering serious or mental physical deterioration. So I know a lot of people do know about the changes in the Mental Health Act, but when we've gone around to GPs, a lot of people didn't know. So if anybody ever wants any more information, you can just let us know. Happy to come round to GP practices to talk about it or share that information. And if there's any questions, you can ask at the end, I guess. Okay.
Thank you.